and 648,000 total deaths from COVID-19. In the United States, as of this morning, we are above 4.2 million cases and 146,000 deaths. Again, for perspective, the United States totals represent fully 1/4 of all COVID cases worldwide and more than 22% of worldwide COVID deaths, despite having less than 5% of the world's population. Unfortunately, we are lagging behind a number of other countries at limiting the spread of COVID-19. Here in Minnesota, our current cumulative total is 51,803 cases. 646 cases were confirmed on Sunday, up from the prior number on Saturday. We did surpass that 50,000 case mark this weekend, and now have a total, as I said, of over almost 52,000 cases, just over 51,800. I think it's kind of important to note that we added over 2,300 new cases from Friday to Sunday alone. This was on a strong testing volume of just over 48,000 tests processed over those same 3 days. But Saturday's new case count of 875 was the highest yet reported since the beginning of the pandemic, if we eliminate that artificially high count on July 19th that we talked about a couple weeks ago due to our data system conversion. The median age of our cases remains at 36.0 years old. It's fallen quite rapidly over the last couple of months. We now have a new total of 1,576 cumulative deaths reported among our fellow Minnesotans. This was up 2 from on Sunday. 3 deaths were reported on Saturday and 5 on Friday. Both of the deaths reported yesterday occurred in residents of long-term care facilities, one in Anoka and one in Blue Earth County, one person in their 80s and one in their 70s. 257 patients are currently in the hospital. This was a net decrease of 16 persons from Saturday to Sunday, but 11 more people are in intensive care, bringing that subtotal to 126. Again, as I mentioned, the weekend testing volume was strong. Yesterday, we received confirmation of lab results on 13,542 samples. The 7-day average testing positivity rate remains at 4.8%, essentially the same as it was a week prior. Over the last week, we've seen a 12% increase in total test volume and a 10% increase in new cases. That is just a week-over-week comparison. I'd like to comment a bit about some of the stories that we saw this past weekend about the varying levels of compliance with the new masking requirements statewide and other measures designed to limit COVID spread. And certainly, just have mentioned the significant numbers of case increase that we've been seeing in recent days in Minnesota. And we continue to hear alarming stories of the speed of growth in some other states and what we've seen in some other states in terms of the healthcare systems becoming overrun. And for months now, we've said that despite all the hard work of doctors and nurses, long-term care providers, public health staff, and so many other people, and the sacrifices made by business owners and citizens to reduce COVID spread, the biggest factor has been and will continue to be the choices and behaviors of us, of we Minnesotans, together and individually. We know that the incidents that get attention on social media or in the press are often not representative of what's happening in most cases. In fact, polling results released last week by Fox News indicated that the vast majority of Minnesotans, fully 85%, have a favorable view of masking, and only 9% reported that they had an unfavorable view of wearing masks. And we know and appreciate that many people are concerned when they see violations of social distancing and mask wearing. We received more than 80 complaints from our fellow citizens just this past weekend about potential violations in public settings, in restaurants and other facilities that we regulate. We really, again, want to thank Minnesotans who are doing the right thing and working hard to protect themselves and their fellow Minnesotans. And we encourage all Minnesotans to recognize that if we all work hard and pull in the same direction and do our part to reduce COVID spread, which is in our power to do, we give our state, our communities, and our Main Street businesses the best chance to remain open and operating. We certainly don't want Minnesota to experience the same catastrophic results of that very, very fast growth that we have seen in Florida, Texas, and other states. And we think we as citizens have a great deal of influence over whether that happens in Minnesota or not. And we have it in our power to prevent that really rapid and uncontrolled spread by doing the right thing for each other. So to be clear, we're not asking Minnesotans to mask up for the health department or for our elected leaders or for the big cities in Minnesota. We're asking Minnesotans to mask up to protect their own health, their own families, their friends, their neighbors, and local businesses. With that, I'd like to turn it over to Chris Erzman.
Thank you, Commissioner. I'd like to comment on the impact of the masking mandate and what that may do to our case numbers. We've heard a number of questions from people about the potential impact of masking on our spread in Minnesota and our daily case counts. And we know that based on patterns of transmission that any intervention like masks will take a little while to show its impact. The cases we are reporting this week reflect the spread that took place in the last 2 weeks. So we need to keep that in mind as we watch case numbers over the coming weeks. We would expect that the impact of the masking requirement would kick in at least 3 weeks from now. So don't be discouraged that our case numbers were large today. We only started masking, the mandate only started on Saturday. So we want people to keep in mind that we expect it could take a full 3 weeks or more to really see the impact of that. And then I'd like to just comment on summer outdoor gatherings. We've noticed a lot of graduation parties and other gatherings outside, which is wonderful. We talk about being outdoors presenting a lower risk than indoor gatherings. But it's important to keep in mind that when we do that, we're still thinking that people will be social distancing. That benefit of being outdoors really comes into question when you have a lot of people gathering closer together, so less than 6 feet and in a tightly packed space. So even outdoors where the risk is lower, it's still not zero. And it's still important to observe social distancing of 6 feet as much as possible. If you're at a gathering where it is going to be difficult to observe that 6 feet of social distancing, we encourage you to wear a mask for the safety of those around you. You may want to wear a mask to an event until you are seated and see what the distance is between you and others, and then when you're assured that you're 6 feet away, you can take your mask off. And then finally, speaking of social distancing and in the spirit of having fun, I just wanted to give a shout out to the Twins. When I was enjoying the games this weekend, I all of a sudden thought that when they were hitting home runs, that was the ultimate in social distancing, that you didn't have to spend time on base with those players from other teams. So I thank them for their efforts in helping us deal with COVID. And I'll turn it back to Mike.
All right, operator, we are ready to take questions.
If you would like to ask a question, please press star then the number 1 on your telephone keypad. Again, that's star then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. Your first question comes from Jeremy Olson with Star Tribune.
Hi, thanks. I was hoping for a little more detail on the 80 complaints. First, some context. I mean, if you have 80 every weekend, then that's nothing new, but is 80 a lot for a weekend compared to recent history? And then can you break down, were they a lot of them about masks, most of them, or give some thumbnail examples of the type of complaints? Just a little more detail would help.
Sure, Jeremy. This is Jan, and I'll pass it to Chris quickly here. But just again to clarify, these are complaints coming in to our environmental health folks in both local public health and the state health department, really about the particular venues that we regulate through environmental health today. In addition to that, there are also complaints being registered with the Department of Public Safety and the duty officer. So that there's a bigger picture than just the environmental health data that we're sharing. But Chris, can you say any more about the breakdown of that number and how representative it is?
Sure. So, Jeremy, looking back, so, at a prior weekend, we received 55 complaints for businesses, 65 complaints, 55 complaints for businesses that were in the jurisdiction that MDH handles. Our environmental health enforcement is a shared responsibility between MDH and locals. We had 65 complaints regarding violations in local jurisdictions. So the fact that we had 80 this weekend is within the realm of what we've seen in the past. So it wasn't necessarily a huge increase.
Can you discuss, was a lot of it based on masks, or was it broader than that?
I don't have that, but I will get that for you.
Okay. And then my follow-up question to that would be, I've been unclear on exemptions due to medical conditions that can make breathing difficult, if only because there's no list that I can find, and maybe I haven't looked in the right place, of what would exempt someone. Because if they don't know clearly, that's going to create some potential confusing situations in the business if someone says they have asthma and someone says, no, that doesn't work. What are the conditions that allow someone not to wear a mask in that scenario?
Chris, can you take that?
Yep. So our goal with the exemptions is that, for instance, if I'm an individual who has a medical condition that makes it difficult for me to breathe, that if I was going to the store and someone, did come to me and say, why aren't you wearing a mask? That I should not have to say, I'm not wearing a mask because I have XYZ condition, and they check it off against the list. Our guidance to businesses is that if someone says they have a medical exemption, that they should honor that. And if you're somebody who does have a medical condition that makes it difficult for you to breathe, it's more important that you know that you would have a difficult time wearing a mask rather than that you had a condition that was on a list.
Okay, thank you.
Your next question is from Emily Huddock with CARE 11.
Hi, a couple questions about the dial back indicators that you guys have listed online. I've been kind of noticing the rate of community spread with no known specific COVID-19 case exposure growing, and I can see that threshold that percentage is above the threshold that you guys have listed, and then it looks like out of these 5 indicators, we're above the caution level on 4 of them. Can you talk a little bit about what you're seeing in these dial back indicators and what that means? At what point does that mean we dial back?
This is Jan. I'll start and certainly invite Chris to comment as well. I think you're absolutely right. We're watching these dial-back indicators with concern. Just to clarify, in some cases, being above the threshold is a good thing. In terms of the testing rate, for example, we want that measure to be as high as possible in terms of how many tests per 10,000 Minnesota residents we're able to process. And you also noted that most of these measures are calculated, in fact, I think all of them are calculated on a 7-day rolling average to smooth out some of the ups and downs we see on a day-to-day basis. Another critical thing that we've talked about in the past is that we have a lag factor in there of about a week. So we're actually looking in the rearview mirror at where things were a week ago, which is important to know. And when we stress that we think trends are going in the wrong direction, the official metrics are based on this 7-day rolling average with a 1-week lag period. But we're also looking to see what is happening during that lag period. So community spread, as you rightly called out, is one of those most critical measures that we track. These are all important for different reasons, giving us a view into whether our hospitals have the capacity to handle the growing the growing rate that we expect to see in future weeks, because as we've talked about before, it can be a further lag of a couple of weeks between someone being diagnosed with COVID and, for some, unfortunately, the illness progressing to a stage where they need hospitalization. Doesn't happen instantaneously for most. Community spread means that we don't know where those cases might have been exposed, and therefore it's much, much harder to do the containment efforts of reaching out to other people who are in the same setting or close to that now confirmed case. So that community spread over 30% gives us a lot of concern. And without getting too much in the weeds, these threshold levels have been set at a place that we think, gives us a little bit of lead time to see where the trends are going and to begin to talk about mitigation measures of what to do. So you've heard Chris and I both, and the governor, I think, in the last couple of weeks, frankly, signaling greater concern that these measures are going in the wrong direction, which is why the mask mandate and why we are, repeating ourselves so often and hopefully clearly about the critical importance not only of mask wearing, but the 6 feet of social distancing and the avoidance of close contacts of long duration, even outside. That the compliance with the guidelines that we've put out there, frankly, is so critical right now. We do feel like we're in sort of a vulnerable state, but we feel like if Minnesotans can understand the importance of complying with the guidance that's out there and the current executive orders, we can impact these rates within a few weeks, as Chris has said. So that was a long-winded answer. Sorry. Chris may have either something more specific or more succinct that she wants to add. Go ahead, Chris.
No, all I'll say is that I think it's important for people to keep in mind that the reason that we're monitoring these indicators is because there could be a time when we do need to dial back if the things that we're seeing continue to go in an unfavorable manner. So that's why it's so important that all of us are working together. We want to keep our restaurants open. We want to keep other venues that have been able to open up open. And in order for that to happen, we've got to be responsible with how we're doing things.
Thank you both. And so just to follow up here, I see the testing rate, we're actually in a good spot, and then 3 of the indicators were above the caution area. And then the fourth, the percent of tests that are positive, I know that you've been giving us kind of the 7-day rolling average rate. You had mentioned before that when we hit 5% several days in a row, that's an area of concern. Can you tell us where we're at on that positivity rate? I don't know if you mentioned that earlier. And then which of these indicators are you most concerned about right now?
Yeah, you are correct. I think I said at the outset of the call that our current 7-day rolling average is 4.8%. So it is close to that kind of lower level trigger of concern. We have said 5% is something, we'd really love to stay below 5%. We consider 5% the low warning threshold, but that 15% number to be really a more significant level of concern. And in terms of overall, one most important measure, I really can't pick one. I think, and Chris may or may not have a favorite in that sense, but I think we've always said that it's really the combination of these factors that gives us kind of the most complete picture. And we know that sometimes when we're seeing something happening in the numbers, we kind of have a pretty good understanding of why. If there's some significant event that has happened, for example. So it's really kind of the way these things interplay and whether we know what's driving it that really informs our thinking. Chris, anything else to add?
Yeah, I guess the thing that I would say is that, I don't have a favorite, but part of the reason that we use a constellation of indicators is because COVID is really rather complicated disease, and really understanding what's happening in the community and in the state is fairly complicated. So we want to make sure that we're looking at it from lots of different directions, and that's why having multiple indicators is really important. If just one indicator was going up and everything else was stable, that would certainly give us pause, but it's really looking at things together and how they interact that's important. And then the other thing is just to follow up on a question that was asked by Jeremy Olson regarding the complaints. A majority of the complaints over the weekend were related to employees or patrons not wearing masks. And one complaint indicated that an employee was wearing a mask, but it was a Halloween type mask rather than the cloth covering that would actually provide some level of source control. So that is the answer to that for Jeremy.
Thank you.
Your next question is from Brian Bask with Minnesota Public Radio.
Hi, Commissioner and Chris. Is enforcement a weak link here in these spread control measures? I mean, we had looks like a rodeo up north where there were some warnings beforehand, but yet still thousands showed up. What's being done when instances like that occur?
This is Jan. It's an important question, Brian. I think we certainly have been saying, we'll keep saying that our most important goal is education and gaining compliance by working with business owners and working with Minnesotans to understand why this is important, why this isn't just, regulators getting up in the morning trying to figure out how to, how to take away people's fun, but why these things really are the tools that can help us manage the growth of COVID that we know is it's there in our communities, it's there in our country. We cannot isolate ourselves completely from what's going on elsewhere in the country, but we need to do what we can to manage the spread of COVID, which we know is with us and is going to be with us for a while. But when education is not enough, it is important to have some regulatory tools. And the reason for doing executive orders is because those executive orders actually have the force of law, which is why the executive orders do contain, language in them and description of penalties. If it gets to that point, that the regulatory authority, whether that's the health department or in local law enforcement or the Attorney General's office or any of a number of potential folks who have jurisdiction, have the ability, after trying to educate, to say, hey, the next step here is a penalty. Whether that's a financial penalty or a restriction on your business or your license. So those things are definitely important. And it's important for folks to know, again, the by far greater preference is that we continue to work with people and help to try to get them into compliance, to help them know what that would take and how to do it. But failing that after a couple of attempts, then I think the availability of penalties is important.
So have there been any crowd size infraction penalties assessed?
I can tell you that I can only speak for MDH. I'd have to defer other questions to other authorities. I think we have prepared a number of enforcement actions. And Chris, maybe you can help me here. I think in the majority of cases where we have been, prepared for the next step to impose a penalty, that the business has come into compliance before that time. But Chris, can you update that or clarify that?
Yeah, we can't speak to open enforcement, but I believe we had one situation where there was going to be a cease and desist, and I'm not sure if that needed to actually go forward because the business came into compliance.
And one follow-up, just because it's in the news, a lot of people are paying attention. You mentioned baseball. Baseball has had a little bit of an outbreak, but also baseball players are getting test turnarounds within the day. A lot of folks are asking, why can't that be the norm for people who feel like they might have been exposed or have symptoms of coronavirus, why can't regular people get their tests turned around that quickly?
Well, that's a pretty fair question. As we've explained, the way that the testing happens, how test samples are collected and by whom and where the laboratory is that clinic or hospital or business or what have you uses, all of that is variable. We've got a complex system with lots of moving parts and lots of private sector actions in the mix here. And in the case of some of the sports franchises and leagues, that they have contracted as a business with a business that has promised them that kind of turnaround time for which they may pay a premium price, and that's a private market fact of life. That we're very frustrated that we know, despite the the much larger numbers of people that are getting tested, we hear plenty of examples from people who should be tested and should be tested faster. We know that the lag times in getting results back, especially from some of the national labs, is growing, and that concerns us deeply because it does compromise, our ability to help people isolate and quarantine quickly enough to really, have the full effect on mitigating the spread. So that's, again, another long-winded answer. I'm sorry it's not more straightforward, but we've just got lots of kind of private market force dynamics at play in a complicated situation that still just has got global supply chain challenges reemerging as a result of the rapid case growth in the United States and several other countries.
Thank you.
Your next question comes from Bill Warner with Minnesota News Network.
Hi, Commissioner. I'm wondering if you can tell me what kind of advice you're giving the governor on the classroom situation this fall for public school students. Specifically, are you, with these latest numbers and the way they're trending, are you more nervous about students being back in the classroom this fall? And a corollary to that, whatever the governor decides, is there a possibility that there might have to be dial back, as we progress into the fall, if we have subsequent waves of COVID-19?
Well, Bill, this is Jan, and I'll just start off by saying I think, the governor, Commissioner Ricker, have both been clear that the value of all this scenario planning that the schools and school districts have been doing over these last months and weeks is important and valuable, because it's very possible that that schools will be using more than one model during the school year for the very reason you said. In terms of the the best advice, the best recommendations that we can give about what the starting point seems to be indicated by the data, that just continues to to evolve. We literally, and I'm sure folks are tired of hearing us say this too, but we literally learn new things, it seems, every week about the data, about what we know about transmission rates and the like. So it's as you are well aware, we've been doing a lot of data analysis and consultation with schools, with parents, with teachers, MDE. I think the Department of Education has done an incredible job of listening to parents, teachers, administrators, to understand what their experience has been over the last number of months. So we are, certainly I should repeat, and thank you for the specific question. I think, the trends of the last few weeks have made this analysis more challenging because we know that what happens, kind of in the larger community affects what happens in the schools, and certainly affects the confidence level of everyone about that question. So again, that's a big part of the reason why these next few weeks are so critical to doing everything we can do collectively to really follow that health guidance that's out there that we believe will help us mitigate the growth that we're seeing now. But it's the time window is short to have an impact that will make that school decision. Hopefully, build people's confidence in it.
Commissioner, are you more nervous? And I understand the announcement hasn't been made yet. It'll come later in the week, I guess. But are you more nervous now about the possibility of students being back in the classroom this fall than you would have been a few weeks ago?
Well, I'm more nervous about kind of the community context. In terms of the impact on schools specifically, that's a harder question to answer than you might think. Just because, again, we're still learning so much about what is the risk in the school setting specifically, and we've learned a fair amount this since the spring. Through experiences that we have had with some of the models that schools have been testing, what we've seen in childcare, what with the emerging experience over the summer. Just the data literally are accumulating, week over week. So I just will have to repeat again, we all know the value of kids being in school, and the governor's been really clear about that. So is Commissioner Ricker. We couldn't agree more from a health standpoint. The educational success is just fundamental to health. So we are just trying to work with our education partners and give them, the most updated analysis that we have about, what the risk factors are and what are the best strategies to kind of mitigate that. And so that is a really active, literally day-by-day conversation right now.
Thank you, Commissioner. Appreciate it.
Operator, we have time for one more question.
Okay. Your next question is from Catherine Richard with Minnesota Public Radio.
Hi. I have a question about how cases are counted if someone gets the virus while they're traveling. For instance, going to a resort up north or going to a cabin in a different part of the state. Is that counted in the county where they acquired the virus, or is that counted in their home county? If that makes sense.
Cases are counted by the county of residence. However, when we do the case interview, we ask people, what activities were you engaged in? What kind of things were you participating in? So if someone, for instance, went to a concert or an event in a different location than their home residence, we would still pick that up because of the case interview. But cases do count based on home residence. But that, just to be clear, that's true for Lyme disease as well. So while we know that there are certain areas that may be at higher risk for, say, Lyme disease, we still count cases based on their county of residence.
So then does that kind of erode any understanding we have of where the virus is most prevalent? And I ask because my guess is that a lot of people are making decisions about traveling within the state to parts of the state where they feel like they might be at lower risk of getting it. But if they're looking at the numbers, that might not paint a full picture of where the virus is.
I think it's important for people to keep in mind that COVID is everywhere in Minnesota. In fact, as the commissioner mentioned, we had reached the 50,000 case point over the weekend, and we also reached the point where we have a case in every single county in the state. So, COVID is unfortunately everywhere, and so the idea that you'll go somewhere to avoid it, I don't know that is probably the best idea. I will say, however, that if we are made aware of situations in which there was an event that occurred in a particular area that we had concerns about, we would certainly follow up in terms of notifying the public related to that. so that they would be aware even if it was not in their home location.
And aside from some of the bars that you've singled out, are there any other events that you can think of where you've had to sort of make that public knowledge to make sure that people know that if you go here, you might be at a higher risk of exposure?
No, we haven't actually, because while we've seen handfuls of cases, we have not seen the large numbers. I mean, when we're talking about some of the bars and restaurants, you know, we're talking about pretty large numbers, you know, dozens of cases versus a handful.
Okay, thank you.
That is all the time we have this afternoon. If you had a question we were not able to get to, please feel free to reach out to the communications office this afternoon. Have a good day, and we'll be back with you again Wednesday.
This has been a WDIO News Special Report.